the UNICEF representative, Mr. Jonathan Veitch, and also a colleague from FCOS, Ms. Vani, and colleagues from the Ministry of Health and Medical Services, UNICEF, and also the media, ladies and gentlemen. I'm indeed honored and privileged to be here today for something that is very personal to me, and that is WASH. I remember as a child and going to the village and facing some of the horrific tales that we talk about now in retrospect of what we faced with challenges in WASH back in the days. And to see how we have moved on as a nation to where we are now, we've taken giant leaps. And that's why, personally for me, WASH is something very important. UNICEF is here because they are obviously handing over the 3,000 WASH COVID-19 kits to the Ministry of Health and Medical Services. But this is not the first time that they've been supporting us. They've been supporting us through normal times and also through emergency response in natural disasters, for example, during the measles epidemic that we faced. At the height of the third wave of COVID-19 Omicron virus, UNICEF supported us in the provision of WASH supplies and technical support and capacity within the Ministry of Health, especially the WASH cluster. And in the aftermath of TC Kodi, the floods that happened, and the tsunami of the Tongan volcano eruption, we were fortunate to be able to partner with them, and UNICEF supported us and the WASH cluster in the provision of 1,000 WASH and dignity kits, 500 collapsible containers, and 10 boxes of water purification tablets. And these have benefited our families and our Fijians in the Western Division initially, then in the Lau group, both in Northern Lau and also Southern Lau, in the islands that have been earmarked as having faced the brunt of the tsunami after the volcano. At the culmination of today's events, the Ministry of Health and Medical Services will again collaborate with UNICEF and the Fiji Council of Social Services in preparedness and response work for COVID-19 and tropical cyclones. And in that note, we wish that in the cyclone season we will not have another cyclone. In this partnership, FCOS will be conducting WASH needs and assessments in rural communities and informal settlements in the three divisions, northern, western, and central in Fiji, and also provide support to the divisional health officers with the distribution of a COVID-19 WASH response kit to affected families or persons in isolation. And at this juncture, I want to say that this is something that we as a ministry are always very interested in, to be able to partner, not only with multilateral partners, but also partner locally with NGOs, communities, because as we've said all along, our way forward is ensuring that everyone takes leadership and responsibility. Not only Ministry of Health providing the technical need and also providing the leadership in terms of what needs to be done, but every part of the community actually doing their part. And the role of FCOS is obviously very important also. The 1,000 WASH COVID-19 kits that will be handed to us today and FCOS, and the 2,000 coming in the coming weeks through UNICEF support, we've also received and distributed 7,013 WASH kits, and this has benefited more than 31,000 Fijians so far, or more than 6,000 households all around Fiji. I'm also pleased that UNICEF, for its long-standing support in the training and the capacity building of health workers and communities. And today we also acknowledge the handing over of a printed community health workers WASH manual, which is this one here that we have with us today. And this was funded through UK Aid, and around 2,000 copies have been received. We will be distributed to the nearly 1,400 community health workers that we have all around Fiji. Last but not the least, we also like to acknowledge UNICEF and DFAT support, the Australian government, on the procurement of field latrines. These latrines are able to address the need to improve sanitation in cyclone-affected and vulnerable communities, and so far, UNICEF has procured 810 units of field latrines, and this has been distributed and installed in communities after TC Herald, TC Yasa, TC Ana, and TC Kodi. When a superstorm or large storm comes through and it actually damages the buildings, what we found in the initial assessments that we did after Herald, that if, say for example, 100 houses were damaged, 75% of those houses had their sanitation facility also damaged. And this is something that's sometimes forgotten when we think about rehabilitation. We are very grateful that working with NDMO, working with the relevant ministries and agencies and UNICEF, we were able to come onto the ground and ensure that these households that have lost a house in their rehabilitation program, or whether they were living temporarily in whatever temporary housing that they had access to adequate sanitation through the support that we had through UNICEF and also DFED. On this note, I also would like to share something that I just sharing with Jonathan today in the room over the other side. I'm very thankful that within the Ministry of Health we have a lot of homegrown, local, some are trained overseas, reputable people that lead our organization. And the strength of our ministry is not only the strength of the central ministry, it's the strength of every facility. The strength of CWM, the strength of FPBS, the strength of the health inspectors under Mr. Vimal's leadership. And what we are seeing come to the fore is this cohort of individuals who are local, who have been trained locally and trained overseas, and their strength in their leadership there for their own facility and institutions, all contributing to the strength of the ministry. So I thank them, and I thank all our institutions within the Ministry of Health, and I also thank you, UNICEF, for your support, and thank you, of course, for this new adventure that we'll have together. Nawalu.
Bula Vanaka, very good morning to all of you. On behalf of UNICEF, it's always a great pleasure for me to come to the Ministry of Health, but I'm really happy today to be present here at the handing over of these wash supplies in support of the ministry in response to the recent TC Cody and also COVID response efforts in general. We appreciate very much how WASH is an important pillar in the ministry's plans and priorities, and really appreciate the leadership role that the Ministry of Health takes in this area. It's so important. WASH is our key pillar for UNICEF, a really essential part of our work. If you look at how we're responding in Tonga, if you look at how we're responding in the Solomons, in Kiribati, we do an awful lot of WASH work. So we're quite busy at the moment, and it's a core part of our mandate, and we're the lead agency supporting the government in the cluster, in the WASH cluster. So last month, as you all know, significant rainfall as a result of the cyclone caused flooding in the northern and western parts of the country, including the Lao group as well. And the flooding caused extensive damage to WASH sources, impacting on sanitation facilities as well. We really commend the ministry's, the whole of government, but the ministry's efforts to ensure effective communities have access to clean water, proper sanitation and hygiene in the aftermath of the cyclone. I was personally following very closely all of the supplies and the trip of the ship to the Lao group over the last few weeks, which was wonderful to see. And to support those who've been affected, UNICEF is pleased to provide these WASH supplies, which include 1,000 WASH and Dignity kits, 500 collapsible containers, 10 boxes of water purification tablets, and they are reaching around 1,000 families in the Lao group and the Western Division. And additionally, UNICEF is pleased to hand over 1,000 COVID-19 WASH household support kits. And you can see what's in the kits on the back of the box there if you're interested in learning more. To aid the distribution of these supplies, a partnership agreement between the Ministry, the Fiji Council of Social Services and UNICEF has also been agreed. And I'm pleased that the Director is present here today as well. And UNICEF has been working very closely with the Ministry in its COVID preparedness and response efforts. I just flew back just now from Nandi this morning. I was with PS Fong last night on the runway with the High Commissioner of Australia to welcome a big batch of Pfizer. So this is the first big batch that's come from the DFAT funded Pfizer donation, which is great. 175,000 doses arrived yesterday, and they have in a special ultra cold chain. They need special treatment and care. So the ministry's done a great job of setting up the cold chain with our support as well. And we've also recently, because of Omicron and the number of test kits that are being used, we've been helping the ministry in provision of test kits, and I think that we've now provided up to 60,000 tests over the last few months. These test kits really help frontline workers to test the most vulnerable people with a simple yet accurate test, as well as good COVID safety measures such as mask wearing, hand washing and social distancing. These tests will allow early detection and adequate care to be provided to those who really need it the most. UNICEF would like to take this opportunity to thank the Ministry for its leadership as the lead agency of the WASH cluster, and I assure you of UNICEF's continued support to the WASH cluster. And please let me express my sincere gratitude to the Minister himself for his strong leadership and personal commitment to WASH and to ensuring families and children's improved access to clean water, proper sanitation and hygiene. And we're really pleased also that children of primary school age will be going back to school next Monday, not a moment too soon. They need to be in school. That's a safe place for them, and everyone has worked very hard, including the Ministry of Health, supporting the Ministry of Education to prepare the schools and get ready, and we look forward to seeing the children learning safely again in their school face-to-face with their teachers. Thank you very much. Waqainabete.
Thank you.
Yes, so the Minister for Health, Dr. Waqainabete, representative of UNICEF Pacific, senior health officials. So like to acknowledge our board chairman, of course, board chairman, Mr. Sepes Rasili, and members of the press. Today for us is an acknowledgement of the centrality of multi-stakeholder partnerships in the effort or in the fight against COVID-19, as well as the effort for community recovery in times of natural disaster. EFCOS is honored to be partnering with both the Ministry of Health and UNICEF in this regard to roll out WASH support to communities across the 4 divisions. Our participation in this initiative involves 2 big activities: WASH needs assessment, which we have just completed, and the distribution of the kits to those most in need of water and sanitary kits. This work is being carried out by community volunteers affiliated to 14 of our 17 district councils of social services, or DCOSs. EFCOS is confident that these supplies will reach those most in need because our volunteers will work in partnership with public health inspectors in their locales to ensure this. Our most sincere gratitude to UNICEF Pacific, as well as to the Ministry of Health for their confidence in working with the Fiji Council of Social Services to ensure that people who are affected, who have been impacted, will receive the support. So once again, Waqainabete.